So good afternoon, everyone. My name is Steve Teutsch, and I am the chair of this committee, and I'd like to welcome everyone to this session of the first meeting of the Committee on Health Effects and Patterns of Use of Premium Cigars here at the National Academy of Sciences, Engineering, and Medicine. This study is sponsored by the Center for Tobacco Products at the Food and Drug Administration, as well as the National Institutes of Health. On the call today, I'm joined by committee members who, like me, are all participating virtually, and I'm going to ask them to individually introduce themselves in a moment. But before we proceed, I want to note that this is an open and on-the-record session. Interested individuals have been invited to attend as observers via video conference. But I want to remind everyone that this is just an information gathering session. That is, the committee is just beginning the process of assembling materials that it will examine and discuss in the course of making its findings, conclusions, and recommendations. Therefore, everyone today should be very mindful of the fact that the committee has made no conclusions, and that it would be a mistake for anyone to leave here to think otherwise. Any comments made by individuals, including members of the committee, should not be interpreted as positions of the committee or the national academies. Typically, committee members do ask probing questions in these information gathering sessions that may or may not be indicative of their own personal views. We anticipate that the committee's report will be released in March of 2022, and that's certainly our aim at the moment. The committee will be deliberating thoroughly before writing its draft report, and once the report is written, it goes through an extensive review process. Hold on here, my computer's acting up. The review process is conducted by experts who are anonymous to the committee, although they will be acknowledged in the final report. This is the first of our information gathering sessions, and most importantly includes a presentation from the project sponsor. The date for subsequent meetings, information gathering meetings, that is, will be identified soon, and will include presentations from invited speakers and a public comment session. In the coming months, we'll also be requesting public input on the draft research questions provided to the committee. Information regarding this will be sent out via the project listserv, posted on the committee website, and made public through other mechanisms. Information will also be posted on the project website. In addition to the remarks we'll hear today, the committee has reviewed information relevant to its charge and will continue to gather additional information over the course of the study. The sponsor's comments will be followed by a Q&A period between the sponsor and the committee members that will focus on clarification of the statement of the task, and if time permits, we will open it up to others as well through the Q&A feature on Zoom. Everyone should note that this meeting is being recorded. So as we start, I'd like to ask each of the committee members to briefly introduce themselves, giving their name and current affiliations. For those who would like more information, brief bios of all the members are available online. So I will introduce myself first and then call on each committee member in turn so they can introduce themselves. So I'm Steve Teutsch. I am currently at the Fielding School of Public Health as adjunct faculty at UCLA and also at the Center for Health Economics and Policy at the University of Southern California. Dr. Bao, are you there? I know you might be on or off. Yeah, I see you. Good.
Hi, this is Wei Bao, assistant professor of epidemiology at the University of Iowa.
Excellent. Dr. Benowitz?
I'm Neil Benowitz, emeritus professor of medicine at the University of California, San Francisco.
Great. Dr. Del Nevo?
Christine Del Nevo, I'm a professor at Rutgers University and the director of the Rutgers Center for Tobacco Studies.
Great. Dr. Fagan? And
Good
I know,
morning.
oh, you
Yes.
are here. Good. Excellent.
Good afternoon. My name is Pebbles Fagan. I'm a professor in the College of Public Health at the UAMS School of Medical Sciences.
Great. Thank you. Dr. Genowitz?
My name is Maciej Goniewicz. I'm professor at Roswell Park Comprehensive Cancer Center in Buffalo, New York.
Good. Dr. Hecht? Dr. Hecht, I don't know, we may have to introduce you later. I know that we are the two Steves on this committee, and the links got sort of mixed up. So hopefully you'll be able to join us. I'll come back to you at the end. Dr. Jones?
Hi, I'm Miranda Jones. I'm an assistant professor in the Department of Epidemiology at the Johns Hopkins Bloomberg School of Public Health.
Dr. Kong?
Hello, my name is Grace Kong. I'm assistant professor in the Department of Psychiatry at Yale School of Medicine.
Dr. Leventhal?
Hi, Adam Leventhal, professor of preventive medicine and psychology at the University of Southern California.
Dr. Mays?
Hi, I'm Darren Mays. I'm an associate professor of medical oncology at The Ohio State University.
Dr. Mesa?
My name is Rafael Mesa. I'm associate professor, Department of Epidemiology, University of Michigan.
Dr. Sterling?
Hi, I'm Kim Sterling. I'm an associate professor of health promotion and behavioral sciences at the University of Texas School of Public Health.
Dr. Valenti?
Hi, I'm Andrea Valenti. I'm an associate professor in the Department of Psychiatry at the University of Vermont.
Great. Is Dr. Hecht back with us? No. Oh, great.
Yes, I'm here.
Oh, good. Please introduce yourself.
Steve Hecht, professor at the University of Minnesota.
Excellent. So next I'd like to introduce Dr. Benjamin Appleberg, who is the director of the Division of Population Health Sciences in CTP's Office of Science. Unfortunately, Dr. Matt Holman, who's the director of the Office of Science, has laryngitis, and I know he's on, I believe he's on the call today, but as he has difficulty speaking because of the laryngitis. We hope that gets better quickly. But meantime, we're privileged to have Dr. Appleberg present in his place. Dr. Appleberg will be providing some background information on the study and present the committee with its statement of task, which will be followed by a Q&A as I indicated. So Dr. Appleberg, let me turn it over to you, and we look forward to getting the additional background and information that you have to provide.
Great, thank you. Can you all see my screen? I want to make sure I'm sharing this properly.
Yes,
we can.
Okay, great. Okay, well, thanks to everyone for being here and for allowing me to come and present on behalf of Dr. Holman. I just wanted to spend a few minutes to give you a high-level overview of the project from FDA's perspective. Okay, so I'm gonna break this up into a few things. We'll talk about who from the various agencies in HHS are involved here, some high-level background on cigar use, and then really turn it over into the regulatory authority of FDA and CTP around this issue, and then specifically the task, objectives, and deliverables, and then we'll have time for discussion and questions. Okay. So this project is being co-sponsored by FDA and NIH. NIH is the lead for the contract, responsible for all deliverable and communication between the parties. And Dr. Sherry Fearman is the NIH task leader and point of contact with NASEM. Dr. Stuart Nightingale is the alternate NIH task leader. And FDA is the agency that requested and funded this study requirement. Oops, I went too far. And Dr. Lisa Lagacy is the FDA point of contact for this work. Just to give you some high-level background of where we are in terms of cigar use in the United States, this information that I put together in these few slides is really for the, in the context of cigar use in general. And, as we'll talk about, what we're really wanting to do is to dig deeper into understanding one specific subtype of cigars, premium cigars, and we'll talk about that. But in 2020, cigars were the most common combustible product used among youth. According to the 2020 National Youth Tobacco Survey, close to 1 million middle and high school kids report using cigars in the past 30 days. And then in certain subgroups, in particular in non-Hispanic Black students, the rates of cigar smoking considerably higher. Although there's been some positive declines in cigar smoking over the past 10 or so years, it's still a significant issue, and flavors really has been shown to be an important factor in their use among young people. In terms of adult use, from the 2019 National Health Interview Survey, the estimate is about 8.7 million adults are everyday or someday cigar smokers. The majority of users are male, but there's been some recent evidence that cigar use has been increasing among certain populations, in particular among women and non-Hispanic Blacks. Regular cigar smoking can cause many of the same adverse health effects as cigarette smoking. And a few years ago, there was an estimate of the attributable mortality due to regular cigar smoking among adults, which was estimated to be about 9,000 deaths per year. As I mentioned, these facts and figures that I'm talking about here are really, across the category of cigar use as kind of typically defined. We'll talk about in a moment is really kind of unpacking the different types of cigars that are currently used. In terms of FDA's tobacco regulatory authority, the Tobacco Control Act passed in 2009 recognized FDA as the primary federal authority with respect to regulating the manufacture, marketing, and distribution of tobacco products. The Tobacco Control Act was originally applied to cigarettes, cigarette tobacco, roll-your-own, and smokeless tobacco. And then in August of 2016, FDA's authority was extended to regulate all products meeting the definition of a tobacco product, including cigars. And in terms of federal regulation, a cigar is defined as a tobacco product that is, one, not a cigarette, but two, is a roll of tobacco wrapped in either leaf tobacco or in any substance containing tobacco. So it's a pretty broad definition, which is why there tends to be kind of a range of products that fall within that category. So one way in which the subtypes of cigars have been kind of described in the US market are the categories listed here. Premium cigars, which we'll talk about, and obviously is the focus of this this meeting and the work that you are going to do. In general, there hasn't been a sort of single consistent definition for what a premium cigar is. In a recent court order that resulted in the prohibition of FDA enforcing the pre-market application requirements for premium cigars, that court order included a definition in it. That's one example of a definition that's been used, and it includes things like having a product that's wrapped in whole leaf, not having characterizing flavors other than tobacco. and being handmade or hand rolled. Those are sometimes, what you see in, in terms of the definition. Other times in some research studies that, there may be a price point that's used as well to characterize a premium cigar. There are also filter cigars or little cigars that are usually brown, have a filter like a cigarette, and typically look similar, in size and shape to a cigarette. Cigarillos are often described as medium-sized cigars, sometimes with plastic or wood tips. And then there's other traditional large cigars that don't necessarily fall into one of these other categories. But I do just want to reinforce that this is just an example of some of the kind of categorizations that have been used to date. To the next slide. In terms of the task before the committee, what FDA is really looking for is a comprehensive and systematic assessment of the public health issues related to premium cigars, as well as the health effects of premium cigars compared to other tobacco products. This information will be useful to kind of, ensure that we have the best assessment of what this evidence base looks like, and to the extent that there are gaps or additional studies that would be informative, could help kind of provide a roadmap for that. In thinking through, public health issues and health effects, as laid out in the statement of work, this sort of includes a number of factors, right? One important consideration is how are premium cigars used? Like, what's the patterns of use? How does that compare to other cigar types, or other tobacco products? And what are the implications of that for exposure to harmful, potentially harmful constituents, and a short and long-term disease risk? To what extent is there literature looking at the short and long-term health effects of premium cigars? So, compared to other subtypes across populations, including exposure to HPHCs, potentially harmful constituents, including estimates of abuse liability or dependence, and how that compares to other cigars or other combusted products, and who are the populations who tend to use these types of cigars as compared to other cigar types and other tobacco products. Demographically, in terms of use of other tobacco products, and factors that may influence uptake and maintenance of use. And this just kind of gives a snapshot of some of the questions that are laid out in the statement of work, just a subset, in terms of the types of questions that we think would be useful to be considering, but really leave it up to the committee to, to really develop and kind of finalize what the focus should be of the report in terms of the specific research questions. But many of these are related to what I just mentioned. So understanding what makes something a premium cigar, and what are the characteristics of those products that cause people to start using them and to continue using them. How do those compare to other cigar types and other tobacco products? What are the short and long-term health effects of premium cigar use? To what extent does that depend on how they're used? What are the health implications for secondhand or third-hand exposure to premium cigar smoke? What do we know about abuse liability, the pharmacokinetics of these products? And I think measurement is, is an important aspect of this, in terms of whether it's measuring exposure or measuring use, how to do that in a way that's gives an appropriate characterization of the products and the individuals who are using them. As I mentioned before, in much of the literature, there isn't necessarily a clear, consistent definition of what makes something a premium cigar. So understanding how research findings vary as a function of how they're defined, or the characteristics that are most relevant or important would be really useful to FDA. And then just the last slide I have here is just a note, in terms of the committee and, identifying evidence. So for us, obviously understanding the what evidence, the committee determines to be the most useful and informative. Are there areas that are gaps, or areas where more research could be conducted to just strengthen the knowledge base? What that might look like would be helpful for providing some guidance for future research, and being aware of the extent to which there may be potential conflicts of interest in terms of the support for research that might be informative or play a part in the assessment and the evaluation of the public health implications of premium cigars. So I think that's all I had for an overview, and I'm happy to open it up now for discussion, questions, feedback from the committee. Stop sharing.
Excellent. Well, thank you so much. That's very helpful, Dr. Appleberg. And with that, let me open it up to the committee. And as we've done previously, please raise your hand if you have questions or comments for Dr. Appleberg. Well, while people do get their questions together, let me ask you one question. So with these varying definitions, does FDA have a definition that it favors and that would provide sort of the broadest context for the committee's work? Or do you have some exclusions from some of the definitions that are out there that you think are not suitable?
No, it's a good question. There isn't currently a federal regulatory definition of what a premium cigar is. We can definitely point you to the language that was laid out in the court order that I mentioned, because I think that, that it has some elements that you typically see when talking about premium cigars. But I really would, what would be valuable is kind of understanding from the committee as the science is evaluated and put together, as I mentioned, to what extent the findings that we're talking about sort of are dependent on how how such products are defined and characterized, and kind of what the implications are of that. So it is I think I just acknowledge that it is a challenge and a little bit messy, but we're hoping that you all can help kind of bring some insight into kind of what the implications are for for the evidence as a function of the characteristics of these products.
Then I take it sort of as a corollary to that, you're not looking to the committee to have its own definition.
Not in terms of like a recommendation for how FDA should define premium cigars, but to the extent that it informs, how you're searching for evidence and evaluating that. I think it's, it's natural that those conversations happen. But yeah, you're right. We're not looking for like, here's a, recommendation for what the definition should be.
Great. Dr. Benowitz.
I've got two questions. And first, thanks for the presentation, the overview. One is, and I should have read this myself, what was the basis for the court excluding premium cigars from FDA regulation? And that's one question. The second question is just, does FDA have any internal data on different premium cigar types, composition, yields, anything like that would be helpful for the committee?
Yeah, I'll start with the second one. we are really looking for you all to base the evaluation off of any evidence that's essentially publicly available to you. We don't have some additional literature or analyses of data to provide. So I do think and as we talked about in the context of evaluating whether there are gaps and additional work should be done. I mean, that would be an informative part of it. In terms of the court order, I think what would make more sense is to just point folks to the to that order itself. I'm not a lawyer, so I don't want to speak to get too involved in the interpretation of the the legal interpretation of that assessment. But I think there's some pretty good summaries available, and we could go back and make sure that gets communicated to the committee.
Great. Thanks, Dr. Kong.
Yes, hi. Thank you for the presentation. I did have a question that I was sort of thinking about for a long time. I'm just curious why the FDA decided to target premium cigar as a targeted cigar product, but not other cigars that you mentioned. I know that some of the question they raised was comparison of premium cigars to these other products, but the target is still the premium cigar. So what is sort of the rationale behind a focus on that?
Yeah, I guess I should say that I think that the fact that we're asking this committee to focus on premium cigars shouldn't imply that we're not concerned about other cigar types. I think the agency most definitely is. This work really stemmed from having an area that we really felt like there wasn't a kind of that basically could use an evaluation and a sort of integration of what evidence is available, what it looks like, how strong it is, the issue of how the products are defined. So it's really the basis is seeing a particular value in having a committee address this particular issue, but it's not meant to suggest or imply that FDA has less concern about other cigar types. I mean, that's not the case at all. And I guess getting to the point about the I mean, I do think you're right. Like in the questions, there's a lot of kind of mention of comparison across other cigar types. And I think part of that is because it's really informative for us to be thinking about and understanding when we talk about cigars, and we have pretty good data, as a, on a category level, but comparing this group premium cigars against some of the other cigar types does seem to us to be informative to kind of understanding what that variation looks like across cigar product use. So even though that's not the focus of this particular request or ask, it like you mentioned, those comparisons are we think are still valuable in helping to understand and interpret the what the science is saying and what it means.
Thank you. Dr. Fagan?
Yep. Thanks, Ben, for that great presentation. Sure. I am very happy to serve on this committee once we're all approved. And but I have a very basic question, and that is, what's the purpose of having an external committee do this? It's a very basic question, but it's an important one because premium cigar is such a very narrow area as it relates to the totality of cigar use. And there's such little published out there. And I also just heard you say that in response to what Neil asked, FDA will not be providing us with any information that they have. You want us to rely on what's available in the external literature. And so given that this is such a small, narrow area with very, very limited data available, what's the real purpose of what we're doing? Because there's so many other topics that are related to regulatory science that are huge, and there's a need to really synthesize that data to make recommendations. This area is so narrow in terms of what's available. So I'm just really trying to get at what the real motivations are about. And I say that saying that I have full intent to serve this committee, but I really want to understand what this is about.
Yeah, sure. So I mean, I think that comment was kind of related to the last one, and I can't speak to. I think you're right. I mean, there are a lot of important topics and issues related to tobacco regulation, and those work on those issues, is and will continue to be happening. This particular issue, I mean, I think just, in terms of some additional context, it's, there has been discussion and dialogue about, should different cigar products be treated differently for regulatory purposes. And as I mentioned, there's already been some court decision that has done that, for the in the interim. And one of the, I appreciate you saying that you're not sure that there's a ton of information here, but I think that would be really useful for us to understand is like having a systematic, comprehensive look at this issue to be able to help guide thinking around how how cigar products are regulated, and what the implications are for different cigar types. But then two, are there areas, gaps that could be filled in? And I guess in terms of the literature that's out there, it would be useful too to understand. I mean, even if to what extent the science that's out there can be kind of like reasonably extrapolated, from kind of what we know about whether it's combustion or disease process or what have you. So I hear what you're saying about wanting to work on other high priority issues as well, and I'm with you on that. But the focus here is really on this this issue of having this really comprehensive synthesis around this topic.
Thank you. Dr. Sterling, you have a comment?
Yes, thank you. Thank you, Ben, for your presentation. So I have a question for you. So given that, as Dr. Fagan has already stated, there's probably very scant literature around the health effects of premium cigars, around perhaps even patterns of use related to premium cigars and the abuse liability for these products. I'd like you, to the extent that you can, speak to the utility of looking at topics beyond patterns of use, health effects, and abuse liability. Can you talk a little bit about that? Is it the desire of FDA to sort of go beyond those topics as it relates to this particular cigar product?
I mean, the desire is really to be able to to ensure we're looking at the public health impact of these products, and that's a pretty broad term and characterization. And so our kind of initial thinking is that reflects a number of different things. It reflects what are the factors that influences who may use these products, how are they going to use them, what are the implications of them, or the of that, both in the short term and the long term. So I think it's pretty broad in that way. And, kind of what would be helpful is to really have the committee help kind of narrow down the focus, or really help figure out what are the sort of the most critical pieces of evidence in that context. So I don't know exactly what, if you have some some particular topic in mind, but my feeling is that it's fairly broad in kind of the way we're characterizing the public health impact, because it really is from kind of upstream factors influencing use to who's using it and how they're using it and what the implications are.
Right. And so just to piggyback off of that a bit, so perhaps an example would be marketing, right, of premium cigars. Would the FDA be interested in literature in that particular area? Again, just using that as an example.
Yeah, sure. That to me, that seems relevant to the extent that it's as we talked about, is a factor that's impacting how these products are used, and and who are using them. But I'm happy to get back and provide any more clarification. Happy to take that back, I guess is my point. But I think the scope is pretty broad as we've defined it.
And one other follow-up question,
Sure.
if I may. So in your presentation, you say that you sort of speak to research, data, and other evidence used to inform the analysis and conclusions. So would it be a fair assumption to say that we would be within our realm or within our rights to look at data beyond the published literature? So say perhaps data that's in popular press, or information, I should say, that's in popular press, or information outside of our typical peer-reviewed studies and data that may come from those types of studies.
Yeah, I mean, I think that could be part of the conversations within the committee, in terms of how, like, where to find the evidence, what's the most appropriate process and venue. I think it's pretty we want to sort of leave that to the committee to really define the best approach.
Thank you. Dr. Fagan, do you still have your hand up, or is that, do you have another question? You're on mute. Hands down. Okay. Dr. Del Novo.
Hi. Thanks for the presentation, Ben. Very useful. Would it be fair then to say that implicit in the task and the charge to this committee is to compare and contrast within the different categories of cigars, particularly with the focus on things that are clearly not premium, because there is no accepted definition of premium, but I think that there is probably some layman's agreement on certain things that are clearly not premium cigars. And so that part of the task is not only just a clear focus on premiums, but cigars more broadly and the patterns of use for the different categories within.
Yeah. I mean, I think, like I said for the last question, I think it's really how up to the committee in terms of the best way to characterize. I mean, the focus is on premium cigars, but as we talked about, like, doing that comparison across how use, for example, or risk or exposure may relate to other types of products that we have maybe even sort of better characterized data on, or evidence is useful. So I think that it allows for it, like, we really want your help in kind of guiding the sort of most specific, kind of the best questions that could be crafted to make sure that those questions are getting addressed.
Thank you.
So, Dr. Appleberg, in terms of the statement of task, It's primarily to elucidate some of the questions that you asked and to talk about the research gaps. In your presentation, you talked about informing regulation and policy. So the couple questions. One is there some tea leaf reading as to why those two things are not totally in sync? And secondly, if it's truly, if I assume that what you said in terms of informing regulation and policy is indeed one of the things you're looking for. Can you provide more detail about the things that would be most particularly helpful to you in terms of formulating those regulations and policies?
Yeah, I guess I should say that I wasn't meaning to spread tea leaves. Yeah, I mean, really, we want you all to focus on the science and what the science looks like and what it, like how strong the evidence is and where there might be areas that evidence could be strengthened or where logical conclusions can be drawn across products. I mean, obviously at FDA, we're a regulatory agency and a science-based organization. And so the science is always playing a role in, informing decisions that we may take. But the task here is not specifically to, for example, recommend regulatory options or policy options. It's really meant to kind of focus on the scientific questions around the impacts of these particular types of products on public health and how they compare to maybe other products that are potentially more better characterized.
Thank you, Dr. Leventhal. Did you?
Yeah, I did. Thanks. I can't figure out how to raise my hand. Hi, Dr. Appleberg.
Hello.
So a question for you about this study and probably other sources of information, like the role it could play to develop a guidance or some or other set of standard procedures for PMTAs for premium cigars. Because if I understand correctly, right, those are on hold. And so can you talk a little bit about that? And then the other question is, the FDA, I guess, commissioned a NASEM report about e-cigarettes a couple of years ago. And so if you could talk about how that report was utilized by the FDA, that might help us in thinking about the current report.
Sure. Yeah, so yeah, I can start with the e-cigarette report. So yeah, I mean, that report was commissioned a few years ago, and essentially the state of the science across a range of topic areas related to the public health implications of e-cigarettes, and that report continues to be a really valuable resource in terms of at least up until that point in time, kind of what were the how strong of scientific conclusions could be drawn about particular topics and questions of interest. I mean, we definitely, and I'm sure others do, cite that work, and then kind of build upon it. Obviously, over in the case of e-cigarettes, the literature is growing much faster. So I mean, going back to your first question, I guess I would just respond in the same way as the prior one, that it's not, we're really looking to get the best assessment of the science to the and the science does inform ultimately, in at FDA, the science does play a role in informing our decision making. But the task here is not like as I mentioned, to come up with regulatory recommendations, but really about the strength of the scientific evidence and areas where that could, it would be advantageous to continue to grow that evidence.
Dr. Gnaevich.
Yes, thank you so much. I also cannot figure it out how to respond. I apologize.
If it's any solace, I can't either.
Okay, so thank you so much for the presentation. I actually want to push you a little bit about the definition, because I think it's so critical thing for our work. You know, if we came out with the different definition for the premium cigars, that later the court or the FDO, your office will be binded to the other definition. That does not, I would like our work to be helpful to you, of course. And, should we assume that the court actually definition with all these 8 characteristics that was listed might be a good start, might be a good definition, proper definition for us to start? I think the definition is so critical that, if we use our definition, we might come out with the different conclusions, what type of products people are using and what are the patterns of use. So the definition, it's so critical. And I cannot imagine that, what would be your advice for us to move forward in terms, we would probably need to spend a lot of time discussing what is really premium cigar.
Yeah, I mean, I see your point, and I think understand that that's been sort of one of the challenging aspects of this area. I think I just wanted to make the point clear that there isn't currently an FDA regulatory definition, but as I mentioned, I do think it's, the definition that's was laid out as part of the court order is something that's out there and that has been communicated and would be useful to look at. I just wanted to, make sure you sort of had that that context. And I agree that the definition is a big issue, but it also strikes me that, for the most part, the science that exists around this topic won't necessarily line up, 1-to-1 with some specific definition that is generated. And so just as important, I feel, would be understanding, as you all are evaluating the evidence, depending on however it's been collected in a particular study. It could just be a question, to use a premium cigar. It could be that researchers use some characteristics that they had, which isn't likely going to be the exact characteristics of, that were laid out in that order in terms of what premium cigars were exempt currently from the pre-market authorization requirements. But what would be useful in addition is to understand the extent to which that, like, varying ways to characterize or define premium cigars may, may impact the evaluation of that evidence, or like what are the characteristics that are the most kind of relevant in that assessment. So I agree that this is a challenging issue. I don't exactly have the answer, and I would think that this is part of what the committee would need to kind of work through. But I think, to your question, that the definition that's that we're talking about, that's been laid out, is a useful place to start to look at how, at least in the context of that particular decision, which has regulatory implications, premium cigars are defined.
Dr. Del Nevo, is your hand still up? Dr. Benowitz, over to you.
Yeah, so Ben, in follow-up to my first question, I did just briefly review some of the court order stuff. And one of the things that struck me, and I know the committee is not addressing regulation, but one of the things that was emphasized was that FDA needed to develop a substantial equivalence process, which also impacts our assessment of the public health impact. So I wonder, and I've never been totally clear about what the FDA does to examine substantial equivalence. So could you sort of explain to us how that is done and how that might impact our decisions on public health impact?
Yeah, and I can obviously too, since there's not much time, we're more than happy to provide more details about the SC process and the regulatory pathways to market. I though I'm thinking about the question of the relevance to the task. I guess I still feel like fundamentally the question that we're asking is really a set of scientific questions in terms of what are the what are the public health implications? What are the health effects? What is the toxicity, of these kinds of products? How do they compare to other? What is the likely HVAC exposure? Is that just a function of how the products are used? Do they tend to be used in a certain way? Are they similar to just any traditional large cigar? Like the questions, it's still fundamentally a set of questions about how well, can we characterize and sort of synthesize the evidence around impact? I guess I'm struggling a little to kind of understand whatever FDA ends up doing with respect to, how premium cigars are evaluated through the pre-market pathways. I guess I'm having a little trouble understanding how that's essential to the ask. But I can definitely, as I say that, I can also provide that detail to the extent that it would be useful. More detailed information about how that review happens, because I don't think we have enough time to go through it anyway right now.
Yeah, that's fine. Thanks.
Okay. Thanks.
All right. Any other comments? Oh, good. Dr. Jones.
Hi, nice presentation. So I just had a clarification question. So for the question around tobacco smoke and associated toxicity, so the comparison group there is among cigar users and non-users. So I wanted to just get clarification around if that was an intentional comparison, as opposed to the other questions where the comparison is premium cigar users compared to other cigar subtypes.
Oh, no, I don't think that was intentional. I think it was just the premium descriptor was just left off. Yeah, I think, but but I'll just reinforce it's really, like I said before, our focus is on understanding premium cigars, but that we think involves being able to compare it to other types of products and be able to sort of figure out where it fits in, and and even to the extent that those products are more well studied, can provide some insight into the into the implications.
Thank you.
Excellent. Any other comments, questions from the committee? Seeing none, I'm going to quickly look through the questions and answers we received from the observers. And many of these are, I think, are comments that are directed to the committee rather than questions for the FDA. I'm going to go through them quickly as best I can, and at least so everybody has a chance to hear what the comments were. One was asking us whether we were going to examine the health studies published by, such as the one by Kaiser in the New England Journal of Medicine. Obviously, the next one was whether a premium cigar is generally a hand-rolled, not a machine-rolled cigar. This gets back to the definition. And we will obviously be looking at those kind of issues. Any data concerning the regular use of versus occasional use of cigars? Again, it seems to be part of the charge to look at the level of exposure. Is it possible to extrapolate to premium cigars based on the composition and volume of the ladder? I'm not quite sure what the ladder is there. If you can, if Adam S., whoever you are, want to elaborate there, that would be helpful. And the next question was about the yield. Again, an elaboration there would be helpful to us to know what the concern was. Next comment was that the court concluded that the FDA has not been mandated by Congress law to regulate premium cigars. Again, that comment for us, at least that's how I take it. And then there's a long comment which I haven't read, so I'm not going to try and paraphrase it. It says, for purposes of this remedy, the court adopted the definition of premium cigar recently proposed by FDA to the District Court for the District of Maryland in the American Academy of Pediatrics case. I
mean that refers to the definition in the court case.
Right. So that's it. Basically elaborates on all of that, and the questioners noted that it doesn't include flavored cigars, mass-produced or machine-made cigars, or an economic quantifier price point. So again, that's all part of this. There's some links that are provided. Comment to please reframe abuse liability, which was termed nonsensical terminology, with misuse liability and addiction liability. Need to talk about actual premium cigar smokers as to how they use these products versus the overall data in cigars across the spectrum. That certainly seems like part of a task. So those are the comments. We're going to capture them so that we all have, the committee has the benefit of those. Are there any final comments from the committee, or comments on the ones I just quickly read? If not, then we'll wrap up. And thank you, Dr. Appleberg. We really appreciate all of the information you provided and the perspectives. And with thanks to all of you who did tune in today. I think I speak on behalf of all of us on the committee that we're eager to dive in and take on this task and do the work. If any of you have comments or questions, please send those to Amy Geller, the study director at Premium Cigars at nas.edu. I'll repeat that, Premium Cigars at nas.edu. But please remember that any material you wish to share with the committee will be made public through the project's public access file. And this process has been instituted because the National Academies comply with Section 15 of the Federal Advisory Committee Act, or FACA, about public disclosure. So with that, we'll end the meeting. The committee members will reconvene in closed session in 5 minutes. And again, Dr. Appleberg, many thanks to you for taking the time to provide the additional information and perspective. We appreciate it. Thanks to everyone.
Thank you.
Bye-bye.